Dr. Brandon Cruz here to talk about the prevalence of shoulder pain, specifically adhesive capsulitis. Shoulder pain has been reported to affect about 2 to 26% of the population, with adhesive capsulitis affecting about 2 to 5% of the general population. Most commonly, women between the ages of 40 and 60 years old are affected by this condition. Adhesive capsulitis is commonly referred to as frozen shoulder and is a diagnosis characterized by gradual and painful loss of range of motion throughout all planes of the shoulder joint. This is secondary to contracture of the glenohumeral joint capsule as well as progressive fibrosis. The causes of this disease are unknown, however are linked to diabetes mellitus, thyroid disease, prolonged immobilization, trauma, and myocardial infarction. There is limited evidence to support the use of many interventions that are typically used to treat adhesive capsulitis. However, there is some evidence that supports the use of manipulation when treating adhesive capsulitis either in the clinic or under anesthesia. Physical therapists can perform this technique after they perform a thorough evaluation and deem it necessary. In the next few videos, I will go over a handful of manipulations that can be used in the treatment of frozen shoulder. So the first technique we're going to do is a posterior glide manipulation. So I've wedged a towel here just to pin down the scapula and stabilize it. I'm going to use both my hands and try and wrap around the joint line of the glenohumeral joint. We're going to add a bit of distraction first. Glide posteriorly and thrust. Our second technique will be an inferior thrust technique, where my mobilizing hand will be on the superior aspect of her humeral head. My stabilizing hand will be on the bottom proximal portion of her humerus, and I'm going to gently distract out. With my top hand, my mobilizing hand, I'm going to inferior glide and thrust. The third variation for glenohumeral manipulation is to have the patient supine, abduct them, and then horizontally adduct the humerus. Have the ulnar border of the hand scoop along the joint line of the glenohumeral joint. Traction laterally and a little inferiorly, and then have your thrust go along that plane like so. For our last technique, we're going to do a seated posterior manipulation. So roll up a towel and place it on the lateral border of the scapula to stabilize. You're going to bring the patient's hand behind their neck so they're in a shoulder flexion, neutral, horizontal, slight horizontal adduction position. You're going to reach around like so, add a posterior glide, and thrust. After the manipulation is performed, stretches and exercises should be aimed at working within the newly gained ranges of motion in order to help maintain the improvement in mobility and function. Exercises and stretches should be done pain-free and progressed according to the patient's irritability levels to help avoid exacerbating any symptoms.